Thank you so much, everyone, for joining us today for our Climate and Health Alliance World Health Day webinar. We're a couple of days post World Health Day, but we're really excited to have this important conversation with some inspiring speakers today around the theme, My Health, My Right in a Changing Climate. Before we get too much further along, I would first like to acknowledge and recognise that my name's Maddie. I'm joining from the lands of the Wiradjuri people here in a little town called Uabalong West. Normally I'm based up in Lismore on Widjabul country. Both places that I spend my time and work are climate impacted communities, and really important, and want to just recognise that the leadership of First Nations communities and people is crucial and central to how we respond to our changing climate, and that there is no climate justice and health justice without that recognition and acknowledgement of the leadership and experiences of First Nations communities. And so I want to extend my respect to any First Nations people present today, and all of the lands in which you're joining us today. Thank you. So this is me. As I said, my name's Maddie Braddon. I'm the Climate and Health Alliance's fundraising coordinator as of August last year. And I come to CAHA with really a deep passion for climate action, which is really driven from my rural upbringing and lived experience of extreme weather events and climate disasters. I've spent a little bit of time studying and looking at the mental health impacts of things like floods, and the ways that rural communities can and do demonstrate resilience. And I'm really excited about the opportunity that the Climate and Health Alliance presents in terms of how we can all work together across all of our backgrounds and unique experiences and all the health impacts. So that's what brings me here today. I'm just going to stop screen. Today's conversation, we're going to hear from incredible speakers, Michelle Isles, Nishad Rego, Shweta Narayan, and Susie Teagan. And each of them are going to present for 5 minutes, and we'll get a chance to have Q&A from everyone who's joining us today. First up, I'd love to introduce you to our new CEO, Michelle Isles. Hi, Michelle. Do you want to give us a wave?
Sure. Thanks, Maddie.
So Michelle is the new Chief Executive Officer of the Climate and Health Alliance and has worked at the nexus of climate action, health, wellbeing and equity in a career spanning 20 years across the Asia Pacific. Michelle has shaped national policy on energy, housing and pollution, and led innovation strategy and collaborative efforts to address climate risk and resilience with communities, health organisations, business and governments. I'll pass over to you now, Michelle, and I'll make sure that I get the slides up. Thanks for bearing with me, everybody.
Thank you so much. Thanks, Maddie, and thanks for joining us, everyone that's here online, and also our panelists. I'm really excited to hear from you. So I'm joining you from the lands of the Gadigal people of the Eora Nation, and I recognise the wisdom of local mobs over a millennia, and the struggles for rights and justice, and importantly, the patience to walk together. I'm normally on Bunurong country down in Gippsland, but I'm here today on Gadigal country for, I think, the 6th edition launch of the MJA Lancet Countdown. And many of you will know, who have been members and supporters of the Climate and Health Alliance, CAHA, that the International Lancet report of 2009 was the catalyst for the creation of our alliance. And with that famous statement, climate change is the biggest global health threat of the 21st century, our organisation responded quickly and built an alliance with many of you and turned that into an opportunity to improve health and wellbeing in Australia through evidence-based policy advice, championing health sector expertise as a compelling voice for climate solutions. It's hard to believe it was in 2010 that CAHA called for a national plan to guide the transition to a greener economy. And that advice and call to both government and to our members and partners was focused on that careful planning to safeguard the health of community. And in 2013, we began the work of starting to build what would end up being a framework by 2017, a tangible framework around climate health and wellbeing that could be taken forward as a tangible resource, but also importantly to influence national and international policy. So in coming into CAHA, I just wanted to recognise all of the work that has come before me, those solid foundations from extraordinary members of our staff, but also our membership, which is really key. And that's something that I want to continue to build on and garner. And so 10 years after that initial call, it was very exciting to see at the COP that Australia did launch a national strategy that we and our members had a really important part in shaping. And today, when I join you, the Climate and Health Alliance comprises over 50 member organisations, representing over 700,000 healthcare professionals in great diversity. I've been on the phone talking to many of our leaders, and if I haven't caught up yet, I look forward to learning about your journey and how we can work together. We've got representatives from Friends of CAHA here today, and many of our partners from On Climate Action, research, from the private sector and government partners that are of course key. Our work, however, in calling for a national framework, we developed some really important work with many of you around a healthy, regenerative and just vision for our future. And I would say that equity is a key measure of our success. As Maddie suggested, that everyone has a right to health, and that's made possible by a healthy planet. So we know that health professionals, policymakers, government and service providers, many of you around this virtual table today, will play a crucial role for a healthy, regenerative and just future for all in the face of a changing climate. So each year, World Health Day draws attention to a specific health topic, and we're rapt and we think it's appropriate that this year is My Health, My Right, as we've seen significant climate changes affecting our most vulnerable populations, but also in the Australian context, we are seeing the strengthening of First Peoples and at long last the recognition of justice and rights. Today we will hear many really important perspectives. So I'll look forward to seeing you again after hearing from my learned colleagues. So thank you for being with us today, and I'll hand it back to you, Maddie.
Thanks so much, Michelle, for grounding us and introducing us in the context of CAHA as well. So I'm really excited now to introduce everyone to the incredible Shweta Narayan. Can you give us a wave? Shweta coordinates the Global Climate and Health Campaign for Healthcare Without Harm, which is an international network of health leaders and institutions across 84 countries, dedicated to making healthcare accessible, safe, and environmentally sustainable. She's based in India, and we're so lucky to have her, and has over 2 decades of experience in advocacy and community organising on environmental justice issues. Over to you, Shweta. Please tell us a bit more about your work and yourself, and thanks so much.
Thank you. Thank you so much, Maddie, for your kind introduction. And thank you so much for giving me this opportunity to share some of my experiences today, especially around the theme of my health, my right. I think, as the theme suggests, my health, my right encapsulates the fundamental principle that every individual has a right to live in safe and healthy environment and access quality healthcare. And it is really, really important to reflect and ensure that my health and my right is acknowledged and addressed in its fullest meaning, especially when we are faced with such monumental existential crisis like climate change. And to me, this concept is very, very deeply resonant to my own experience and my own lived experience, because I grew up in eastern part of India in a small industrial township surrounded by steel smelters and coal mines. So air pollution, water pollution, occupational risks were a daily occurrence, given that my family was also dependent on the industrial facility. And in my work in the last 2 decades, working at the intersection of environment, health, climate, and justice, I have borne witness to same injustices, the same environmental crises across communities, not just in India, but in South Asia, Southeast Asia, and also attempt to address some of these inequities. So this feels really, really personal, and I think there couldn't be a better time to address the issue as today, because it's a reality. The climate crisis that we are collectively facing is a reality. It's no longer an issue of the future. And the most sobering example of this was 2023, which was the hottest year on record ever. And perversely speaking, it's the coolest summer that we ever experienced, because this is going to get worse until we do something radically different right now. And it's important to remember that, and it's important to recognize and acknowledge that in addressing the crisis that we are collectively facing. And in addition to the climate crisis, we are also facing a crisis of biodiversity and biodiversity loss and pollution. So it's collectively we're facing triple planetary crisis. And as I said, unless we do something radically different, we are seeing a very tame preview of what is yet to come. And my intention is not to scare or create a gloom and doom atmosphere, but it's also facing the reality, because unless we acknowledge that there is a problem, we will never address the solutions, or we will never embark the pathway of solutions. And just a little bit of reflection from India, especially given that we are notorious for the poor air quality that we have. And globally, this was the 6th year in a row that our national capital was declared the most polluted capital in the world. And especially, that means that vulnerable populations like children, pregnant women, elderly are most at risk. And the same goes for the climate crisis. The most vulnerable, the most marginalized, who have least contributed to the problem, are facing the worst impacts of the crisis, not just in increasing air pollution, but also extreme weather events, floods, droughts, increased vector-borne diseases, water shortages. We're seeing the worst kind of impact that is pushing people back into poverty, also because of poor health and lack of access to healthcare infrastructure. And these cycles of disasters are so fast and so repeated, it hardly gives people time to recover before they are hit by the next disaster. And this in some way, we need to strategize in a manner that we are able to break this cycle and uplift people out of the marginalized circumstances that they're in. I just want to quickly also reflect on the fact that, I mean, for the last few years, I've been working specifically with the health community. And I very strongly believe that the health community has a lot of solutions to offer, a lot of pathways of ensuring that the environmental health inequities are addressed in the solutions that we are putting together for climate. And in this, I believe that the health professionals have a very important role to play. And I'm saying this because often when I've interacted with health professionals, I've seen that, they have expressed this reservation about what role they can have in climate action, in advocacy. And if you look at the rich history and legacy of the health community over a century and a half, where the health community has shaped the society that we live in today. And I'm not talking about just curing diseases, but also shaping the social movements, the justice movements like racial equity, women's rights, nuclear war. In every aspect, health community has contributed with evidence, with analyzing issues from a public health lens, and made the society more progressive and more inclusive. So throughout history, there is evidence of health community making significant contributions. Why should it not be when it comes to the issue of climate crisis and climate threats that we face today? The health community has the first-hand evidence of the impacts, of the worst impacts of the climate crisis, and generating that evidence and sharing it to build solidarity, to convene a wider cross-sectional communities, other movements and other civil society partnerships for a stronger coalition to demand climate action, and also to hold governments and corporations accountable. The health community has a very, very important role to play. So to me, My Health, My Right is a rallying call for that collaboration, for that solidarity, for uplifting marginalized and most impoverished communities, and that collective social power that we have that can bring about a change. We need to come together as the majority that we are and influence this change to ensure that every individual has their rights and their and justice enshrined in their right to life, and at the same time, no one is left behind. Thank you very much for giving me this opportunity.
Wow, thank you so much, Shweta. That was incredibly compelling, and you tied in a lot of important messages there around both the impacts and what it means for My Health and My Right, and also the incredible historical role that health professionals have played in shaping the solutions and how we can continue to do that. Thank you. Next up, we have Nishad Rico. Could you give us a wave, Nishad? So Nishad is the Advocacy and Policy Manager at UNICEF Australia, and holds the portfolio in climate change, emergency response, disaster recovery, with a focus on highlighting the disproportionate and unique impacts on children and young people, integrating child and youth voice in climate decision making, and promoting child inclusive climate policy making. I'm really glad that you're here, particularly reflecting on my own journey. I've been at this since I was 16, and I've definitely felt the impacts as a young person who's now a grown up. So I'm really glad that you're doing this work, and I'm sure that is a story that resonates with an increasing amount of people, unfortunately. So over to you, Nishad, and thank you.
Thanks, Maddie. Thanks for having me today. And let me also begin by acknowledging the traditional custodians of the lands from which I'm calling, the Gadigal people of the Eora Nation, and pay respects to elders past and present. Can also say congratulations, Michelle, on your appointment, and also once again acknowledge CAHA and all of you on this call for your work on the National Climate and Health Strategy. I was in Dubai when it was launched, and heard the minister speak in very encouraging terms about the work of civil society in getting this over the line. Of course, it's only a start, it's a document, and there's so much more work to be done. Just very quickly to say, UNICEF's work is underpinned by the Convention on the Rights of the Child, and Article 24 states that children have the right to the best healthcare possible, to clean water, to healthy food, and generally to a clean and safe environment. Article 12 also talks about the right of children and young people to participation in and engagement in the issues that affect them. So there's a very fundamental commitment both to participation and to better understanding how climate change impacts children and remedying or addressing some of those impacts that goes back to the convention. I just want to make three quick points about the intersection of children's rights, climate change, and healthcare. So the first one is that we need to put children and young people's health and well-being on the map when it comes to climate policy making. Children are the least responsible for human-induced climate change, and yet very likely, in fact, inevitably, will face its worst consequences in the future. But also, this is not just about future generations. Children are highly exposed, as we know, and uniquely vulnerable to the health impacts of climate change today. Just to give you a couple of statistics, in terms of exposure, children born in the Asia-Pacific region experience 6 times more frequent climate-related disasters than their grandparents. And a child born in Australia in 2023 will experience 4 times as many heat waves, 3 times as many droughts, and up to 2 times as many bushfires and river floods than a child born in the 60s. So I'm sure we've all felt that in our daily lives, in our experiences of the last few years. We also know that children's vulnerability to the impacts of climate change is not, it stems from the fact that they are not just little adults, that they're at a much earlier stage of physiological and cognitive development, and therefore less equipped to deal with climate-related shocks and stresses. And there are many dimensions to that. The other point to make is that children and young people are extremely worried about climate change. Climate anxiety is a significant problem amongst children and young people. A UNICEF survey in 2021 found that something like 84% of young Australians were very or moderately worried about climate change, and almost half of those who were surveyed felt distressed to the extent that it was affecting their daily functioning. Of course, the other point here is that sudden and slow onset natural hazards are disrupting key social service systems that are critical to children's development and needs across the board, whether that be early childhood education and care, education, the healthcare system itself, and the prospect of secure livelihoods in the future. Right? So that's another key element of this challenge. The second point I wanted to make is that we need to find ways in Australia of strengthening targeted investment and place-based climate and health policies, children and young people. And this stems from the fact that we know that not all children are impacted equally. This is the same across the population, but I would say that the intersection of what we call in policy speak the polycrisis, the inevitability of more severe and frequent climate events, pre-existing disadvantage, and also institutional fragility. There are or service fragility. There are parts of Australia that and I'm sure Susie will talk to this, particularly in rural and remote Australia where services are not as present or robust. All of these things kind of combine to mean that some children and young people are at a significantly lower starting point in terms of resilience and preparedness. This is both an international problem, so a transnational problem. It's also a domestic problem in Australia, and children from low socioeconomic backgrounds and particularly from First Nations communities are more likely to experience climate impacts as disasters. And then the third point to make is that we need to ensure that children and young people are part of the conversation on climate solutions and on how we move forward as a country and as a global community as well. We know that children and young people are agents of change, but also that they're not just loud voices, that they have unique and very valuable perspectives on specific solutions, both from their lived experience, but also from expertise. Whether it be, for example, the advocacy of university students in the Pacific in support of the advisory opinion that will be forthcoming from the International Court of Justice on the obligations of states under international law to protect the rights of future generations against climate change, whether it be the Duty of Care Alliance or groups such as SEED, whether it be the work that children and young people do in emergency response. Children and young people are part of the solution in so many ways and need to be heard. And this is one of the challenges when we talk to children and young people, they do not feel like they are being adequately heard. There was a survey, again, I think it was 2021, it's called the Our World, Our Say report, that found that only 13% of young Australians felt that they were being listened to by leaders and government on climate change issues. So that needs to change. The last point I'll make in terms of child and youth participation in climate policy making is actually there's also an obligation on governments, on decision makers, on policy makers to provide young people with the necessary skills and education for them to be able to participate adequately and in a constructive way in the kind of language and milieu and spaces that are accepted in climate policy making, but also so that they can participation also enables learning and enables young people to take what they've learned back into their communities and build a movement, so to speak. So there's this dialectic between education and participation. Look, I might leave it there, but looking forward to continuing the conversation in the Q&A.
Thank you so much, Nishad. Really important perspectives there. And yeah, I'm so glad that you're in the role that you're in, doing that work. So next up, we've got Susie Teagan. Hi, Susie. Thank you. Susie is the Chief Executive of the National Rural Health Alliance, which has a remit to ensure that the 30% of people who live in rural Australia have access to services that improve their health outcomes, support medical and health practitioners, as well as health researchers to train future medical and health practitioner workforces. She spent most of her working life living and working in rural, remote and regional Australia, advocating for these areas, and has a really colourful career across all sorts of roles. Over to you, Susie. Thank you. Would love to hear about the unique insights from rural and remote Australia around our changing climate. Yeah.
Thank you, Maddie. First of all, I'd just like to say thank you for bringing such a diverse group of people together. And the reason it's important is because we often think in our little passage, but when you hear other people's discussions and important points, you start reflecting on, well, how does that impact my sector or my view on things? So I'm coming from Ngunnawal country today, so I'd like to acknowledge the people from this country. This My Health, My Right is a really important drawing together of many different entities and individuals' views, but also, well, how do we move ahead in terms of how does it affect people in general? And I'd like to put it in context. So the 30% of the population that live in rural, remote and regional Australia, so a little bit over 7 million people, they are a major contributor to Australian economy. And the reason Australia has such a wonderful life and why so many people want to live here is purely because 2/3 of Australia's income comes from rural, remote and regional Australia. And that 30% also brings in 50% of the tourism income and puts 90+% of the food that Australians eat on our tables. And so, you know, we really rely on this region. And the interesting insight that we found is that despite the fact that they are such resilient and, you know, active communities, the Australian population that lives in rural Australia actually has, for numerous reasons, is particularly prone to the climate change and the climate impact of fires, floods, and droughts is so much more intense in those communities. And it makes it for a very difficult activity for health policy and governments and entities that deliver healthcare, because in one way they're relying on the economic contribution. In another way, they're saying, well, these communities are already much worse off than those people that live in urban centres. So we know there is an increasing trend of disease burden in those regions, that heart disease, chronic kidney disease, chronic pulmonary disease, lung cancer, suicide, mental health issues, and obesity are much higher. In fact, the burden of disease is 1.5 times higher than it is in major cities. And so how do we assist those communities, and how do we work with those communities, and how do we plan to assist the communities in dealing with the more current and the more, like Shweta said, we have these impacts of climate through droughts and floods and heat coming at us much more often than we would in other years, you know, 10 years, 30 years, 40 years ago, because we've always had disasters, but they're coming more often. And how do we do that? How do we deal with it in a way that it doesn't continue to damage our health outcome, but also it doesn't reduce our productivity? Because our productivity is important and it needs to be continued to be taken in consideration, rather than just focusing on how does it affect us right now, or how does it affect us in future, with putting so many policy levers and everything in place where it may actually affect our productivity in future. The direct effects on communities through those storms, floods, heat waves and fires are major, and the recovery process of those communities is not able to be addressed as quickly as it should be able to be addressed. And we're finding that the majority of communities around Australia actually need a holistic policy from government. They need to be included in strategies, and that includes the Aboriginal and Torres Strait Islander communities. They need to be included in coming up with solutions that not only impact health, but they impact the way they deal with their economic contribution, whether it's through tourism, whether it's through industry, or whether it's through education and the education system. And they also require, at the same time, strategies that assist them in being able to deal with mental health and the delivery of health strategies. In addition to that, food security and vector-borne diseases. And so this is a discussion that really needs to go across portfolios of government, not just health. It's health, housing, education, food and primary industries, and economic development. And it cannot be finger pointing of you as an industry need to change, when actually we all have a responsibility and we all rely on the income that we currently receive from all those different sectors. Thank you.
Thanks so much, Susie. So many important points that you've just made there that are unique to rural and remote and regional Australia, but also that we can learn from across wherever we're coming from. I'm now going to pass back over to Michelle, who's briefly going to share a little bit more about her experiences and also the Climate and Health Alliance and our work and how it relates to My Health, My Right in a Changing Climate.
Thank you, Susie, and thanks to my fellow speakers. They were quite incredible insights, and I was thinking about the work that we do with our members across Australia and New Zealand that touch communities in many different ways, from health services in large cities that deal with great complexity and pressure, and yet are carving new ways to bring in the insights of citizens for person-centred care, but in that, with climate disruption facing that increasing pressure. We also work with members that are in remote and regional communities that have been now regularly experiencing climate impacts and working outside of their remit in the community to help understand and advocate for better preparedness, and also to tune in and listen to how their patients and citizens are responding to some of these changes. I'm on Gadigal country today, and I was again last week, and I had the opportunity to hear from Uncle Michael West. And it was quite a profound welcome to country that he offered. Some of you may have been present at the conference on Friday, because what he did is he placed us in the landscape of Gadigal country. And so out of that conference centre, out of our clinics, out of our hospitals and healthcare facilities, we got to think about the health of and the underpinning of those waterways and landscapes that shape country. And I got to thinking about that very simple but sophisticated premise of healthy country and healthy people. And I think when we think about a just future in the Australian context and in Aotearoa in New Zealand and the Pacific where we work, listening to and tuning into First Peoples perspectives, but also the environmental conditions of which we are a part. Rural and regional communities are both advocates and also knowledge holders in terms of the way in which they interact with their environments. There have been many international treaties that indeed spell out the rights and the connection to protect country and the environment. And so I think that's a starting point for us as we look at the national and Pacific landscape, where the environment is sick, then our communities are sick. And where they are under stress with the increasing climate impacts, we will see more stress on our healthcare workers. And they are represented through our members, And for many years, we have now been working in collaboration to not only build a narrative and policy around how we can communicate that impact on the healthcare sector, but also empower healthcare workers and professionals to be able to articulate that impact that they see at the emergency door, that they see through systemic health problems in communities. I also wanted to mention that our organisation, of course, works globally. We work in partnership with Shweta. CAHA delivers for the Pacific, the Global Green and Healthy Hospitals program, and the 2,500 healthcare facilities and hospitals that are part of that program across Australia and New Zealand are actively trying to transform the way in which those facilities work, but also tuning into the health practice and the voices of patients and communities that use those services. And so we have, by delivering this program over several years now, have great insight into some of those challenges, both the resource need to be able to sustain those health services at a basic level, but in the face of climate change, it needs new solutions, new ways of learning and practicing medicine and healthcare in this new phase. We are really rapt that, as I mentioned earlier, that the National Health and Climate Strategy was launched. It is a comprehensive document and guide for us to take forward, and CAHA is very much now focused around that implementation. We were very happy to see that there is a focus on the voices of First Peoples and vulnerable communities, and the National Climate Adaptation Strategy, which is out for comment at the moment with risk factors, needs to focus, I agree with Nish, on that place-based climate impact, so from the bottom up, but also looking at that national level as to where are the risks and challenges and how do we bring in the voices of our diverse communities to have a say, and that includes children, to have a say in how we shape and invest and resource that resilience work to mitigate the impacts and future impacts of climate, but also in the situations that we find ourselves today. I live in Gippsland, and you may know a month ago we had extreme storms and hurricanes. So most of the population were without power. The healthcare system was trying to deal with not only the existing pressures of providing services in a regional community, but with great vulnerability, and not only at the point in which trees fell on homes and people experienced great vulnerability, but that lived experience of trauma and psychological impact that will persist is now, unfortunately, something that is known across Australia and indeed around the world.
Thanks so much,
is something
Michelle.
that connects us globally, and that universal right to health, but now reframing that and thinking about that in climate disruption brings new questions, new opportunities for us to work together and collaborate to ensure that we can create a safer future. Maddie, I think you wanted to move us along.
Oh, no worries. I think it's great that you've covered what you have, and thank you. Another massive thanks to all of our panelists for sharing your unique perspectives, experiences, and expertise from where you're coming from. I'm going to kick us off with a question. We'll probably have time for one or two other questions from our attendees, but I want to throw this one to the whole floor. Given everything that we've talked about today, how can individuals assert their rights to their own health and how, in the context of our changing climate, and how can health professionals, governments, policymakers, and service providers work together to enable that? And maybe you've got some examples of where that's happening.
I think one thing is that everyone has power in their circle of influence. So one aspect is working with your own family. The second one is you working in your role. And I always look at the third one as me as a volunteer or as a contributor to society. And I think within your role, that's usually the policy input that you might have, and really working across sections, because I think if we stay in our little area, we actually end up having more of we have less of an impact than if we work across sectors. And Shweta said it very rightly before, where, you know, we rely on the economy and we rely on the work, but we also know this. And so you have to work across all those sectors. You have to, and Nisha was talking about education, like you have to work across the sectors and demand that to occur.
I just want to jump in over here. And I think this is where health as a shared concern can play a very instrumental role. The fact that the concerns about health can bring people together across communities, across class, across age, because it is indeed something that bothers us on our daily life. Our health, our children's health, our family's health, our community's health, you can, keep expanding. And the health community has that credibility and the trust that we need to leverage to convene across sectors. And it's also important, and in the interest of the health community to convene across sectors, in addition to all the points that Susan has mentioned, is because actions of other sectors impacts the health burden and the health responsibility of the health sector. So even if health sector is doing everything right and reducing its climate footprint, and if other sectors are not aligned, then the health burden continues to increase, and the pressure on the health sector to deliver would always, and we'll always be playing catch up. Just one more thing that is important to recognize in today's time is that we are living in a society that is being hit by violence across. Violence in terms of war, conflict, or by nature because of extreme weather events. And that has led to an incredible trust deficit in institutions, in governments, in international mechanisms, and people are forced to take their destinies in their own hand. Not always that leads to the best outcome, but like it just looks like the society is getting fragmented more and more. And in these circumstances, under these circumstances, again, I think people look at the health community to bring everybody together. Health community has the power of healing. And that is really, really important. This is goes beyond just providing services. And historically, it has had the role, it has the moral, ethical, powers that it needs to bring, communities and people together and truly heal, not just people, but also the planet, because our health depends on the health of the planet. So I think somebody was mentioning about, thinking in systems, breaking those silos. And I mean, we have no other option. We are running out of time. So it's important that we can facilitate a gathering of communities, stakeholders, policymakers, everybody together. And to me, my sort of single most important suggestion is how I feel is that it's time that we hold our governments accountable and make them take the right actions in the right direction.
Yeah, can I just pick up very, very quickly on a couple of points? First, Susie's point that this is a cross-sector, cross-society challenge, and Shweta's point then about how we hold governments to account in that context. I think we face from an influencing and advocacy point of view in any political context, we face a couple of challenges, and I don't have answers for these challenges, but it's something for us to think about. So one is, you know, how when you have a problem like the health impacts of climate change on the population as a whole, and there is responsibility across sectors, across institutions, and across levels of government, how do you actually, as advocates, begin to distill that responsibility and actually designate it, and then put pressure on the different parts of the ecosystem to take action? So that's you know, an eternal, I think, challenge that we need to confront. And I think organizations like CAHA, that bring together such diverse coalitions of community members, organizations with different interests and perspectives, play a really important role in this way. But the other thing, and this is something I find challenging in the Australian context, is the decision-making complexities at federal, state, and territory, and then local government level. And that, you know, the health and climate strategy is a really good example of a brilliant document with a framework and some quite detailed ideas for what next. But when you look at practice across state and territories, they're quite different. When you look at how, or the capacity and the expertise in different local councils to respond in different ways, very different. So I think that's another really big challenge for us to deal with. Leave it at there.
So with 5 minutes left to go, which just sort of shows how needed these conversations are and how wide-ranging the issues are when it comes to our rights and our health in climate change. I'm going to try and bring together all of the questions in the chat, and thank you to those who have asked them, and throw it back to the floor. So there's themes around leadership and our representatives, and how we grapple with, you know, the difference of views and opinions of the way that change should happen in different areas and regions. There's some things about acknowledging vulnerability without disempowering people in regards to their health. And then there's also something about what inspires each of you to keep doing the work that you do. So I'd love to invite all of you to just share, you know, 30 seconds by way of wrapping up in terms of some of those points, if you can.
Leadership happens at all levels, and this picks up on the previous question. So we've heard about leadership in our community, and that's certainly where I've been able to create change in the regions. You know, people have connection to place, connection to each other, and it's through that shared health and well-being that we can actually begin to understand what healthier futures in regions look like. For example, in health sectors, in hospitals, we have really specific opportunities and in fact responsibilities for communities, First Peoples, to be advising on and leading on and shaping the way in which health services are delivered. And of course, we've long called for health in all policies, which Nish picked up on the challenge. But I think we need to see that. We need to see not only sectors, but individuals working on transport, working on infrastructure, seeing that through a health lens, and we're there to enable that connection. And it's that kind of work that excites me to get up in the morning.
Yeah, I was just going to say, I think one thing we have lost is an opportunity to actually listen to people. We've got a disconnect between urban and rural Australia, and we've got a disconnect between what we said we would be willing to do. I think we need to ask more questions. And the reason sometimes people get their backs up is purely because they feel like they're being blamed. And sometimes it's accurate, sometimes it isn't. I think we need to just talk with each other with a little bit more care. And I think that's something we can learn from Indigenous communities.
Thanks, Susie. Shweta?
Okay, I mean, I just wanted to address this question about notion of vulnerability and acknowledging that. I think one way to do that is to make sure that our solutions and our actions are rooted in justice and equity, ensuring that there is participation of the most marginalized. They are part of the conversation. They're part of the solutions. They lead some of the solutions. It's not like marginalized people are only victims or survivors. They have solutions that have often been neglected for profit of big corporations, let's face it. And so I think inclusive participation, transparency, and accountability can be empowering, at the same time addresses the vulnerability of the people. And for me, and this is where I get sort of clinical about what inspires me, is the fact that what choice do we have? We have to do the right thing. We have to be on the right side of the history. And for that, we just need to believe what we're doing and in the collective power of the society and continue. We just, this is our responsibility to the future.
Yeah,
Absolutely.
I mean,
Thank you.
well said, Shweta. I think I agree with absolutely everything you've said and everything everyone else has said. Just to say, I guess what inspires me is to be exposed to, or to work with, children and young people who both understand that they have no choice, but also have a hope that perhaps those who are more jaded don't, and understand the ways in which they can translate that hope into concrete action. So yeah, we need that, right? We need everything we can get. So onward, really.
So I just would like to say a massive thank you to Susie Teagan, Shweta Narayan, and Nishad Rigo and Michelle Isles for all joining us to share their stories, and a lot for us to all reflect on. We will be following up with all of those who have attended, sharing how you can stay in touch with all of our panelists' work. And of course, if you would like to stay in touch with the Climate and Health Alliance, for those who are not already involved, please consider joining as a member or a regular giver of our work, so we can keep running these kinds of inspiring and necessary conversations. So thank you to everyone who's been part of this conversation, and we look forward to seeing you again soon.